Hello, everyone. My name is Yvonne Ortiz. I am the Training Institute Manager for the National Resource Center on Domestic Violence. Thank you for joining us today, and welcome to our webinar titled Resilience, Trauma, and Hope, a Healing Response. This is part 2 of the series Loss, Self-Care, and Healing, Surviving and Thriving in the Midst of a Pandemic, a Community Response to Loss and Grief to COVID-19. If you didn't get a chance to participate in part 1, you can find the recording in our online library bonus. The link will be posted in the chat. Before we start our session today, and we're very, very excited, I want to tell you a little bit about the work of the National Resource Center on Domestic Violence. At the NRCTV, we work towards strengthening the capacity of programs responding to domestic violence survivors and their families by promoting effective programs, policies, research, and engagement in prevention. Beginning in 2016, NRCTV engaged in a racial justice initiative designed to transform policies, procedures, practices, and organizational culture to be racially equitable and inclusive. NRCTV's internal work to advance racial equity included the NRCTV stance that you're looking at it. This statement guides our work and keeps us accountable to those communities that we stand in solidarity with. Our webinar today will focus on the impact of trauma and will explore how to center hope, healing, and resilience for ourselves and our community. The presenters will introduce a holistic healing approach involving culture, spirituality, civic action, and collective healing. Help me welcome our presenters. Hi, Vanessa, and hi, Latoya. How are you ladies today?
Hello, Yvonne. I am doing well. I'm so excited to be here. So excited to be here with you this afternoon and with all our participants.
Yes. Hi,
Thank you
Vanessa.
so much. Hi. Very happy to be here with you all too, and so excited to get to some good healing and learning happening soon.
We are ready. We are ready. So before we start, I'm going to tell you great things about Vanessa and Latoya. I'm going to read their bios. Vanessa is a licensed psychotherapist, Reiki master, yoga teacher, public speaker, graduate level adjunct professor, and owner of Kindred Tree Healing Center. She has extensive training in play therapy and other expressive therapies like art, music, and sand tray. She brings forth over a decade of expertise in the areas of child development, parenting, trauma, and attachment issues. Prior to opening Kindred Tree Healing Center, she worked at various nonprofits as a therapist and considered herself a child and anti-violence advocate. She's been in director-level positions within organizations, including operating a clinical counseling and court advocacy program for child and adult survivors of violence and human trafficking. She also enjoys speaking at conferences all over the nation and providing supervision and consultation to organizations and therapists regarding attachment, trauma, and expertise play art therapy. This is an amazing Vanessa. And now Latoya Mcleod is a licensed clinical social worker based in Queens, New York. Latoya has been practicing in the field of social work for over 10 years, with her expertise spanning from child welfare, hospital behavioral health, and schools. Latoya is currently a high school social worker where she serves as a member of the Clinical Crisis Response Team, provides individual and group therapy, facilitates staff, parent, and student trainings, and support groups. Latoya is the owner of her private therapy practice, Mcleod Counseling, where she specializes in the treatment of anxiety, mood disorders, and major life stressors. Latoya utilizes a combination of cognitive behavioral and solution-focused therapy as a means of healing and helping others live a healthy, fulfilling life. Latoya is a strong advocate for self-care. Latoya received her Bachelor of Arts in Psychology at Hunter College, City University of New York, her Master's of Social Work at Silverman School of Social Work at Hunter College, and her post-grad certificate in advanced assessment and diagnosis at NYU. So, ladies, we are ready for you, and Latoya, take it away.
Thank you. Thank you so much, Yvonne, for such a warm welcome. I am indeed honored to be here this afternoon and to share this space with everyone this evening for such an amazing and necessary topic. I want to thank the entire NRC team working behind the scenes to make this, come to fruition. This is such an amazing time for us to do this. Arlene, I want to say thank you as well for extending the invitation. And our participants, I hope that we can get an afternoon filled with healing and learning and encouraging from each other. I welcome all chat, all conversations in the chat box. I will do my best to go through my presentation and back and forth with the conversation in the chat as I go along. So please leave your comments, leave your thoughts, leave your questions. I hope that this afternoon, as we peel through the dynamics of trauma and healing and this unprecedented time that we're living in, that you will leave with a message of hope and a message of resiliency, right? That we will learn that we are resilient people and we are survivors, right? So we're going to peel through a lot of things this evening, this afternoon, and some of it might feel a little heavy at times, and some of it, are things that as advocates, as people working in the field, as caregivers, that you're already familiar with, but it's never been a more important time to use this space and this platform to have these conversations. So again, I invite all conversations and thoughts as I go through this afternoon in this presentation. So just an overview of what I'll be going through. We're talking about the COVID-19 pandemic, right? Unprecedented time. Life as we know it and our lifestyle or livelihood has been turned upside down. On its head, we're left with a lot of what now questions. Where do we go from here, right? And it leaves us confused and traumatized and, with many questions, few answers. But as I said, I want us to have a feeling of hope and resiliency and healing this afternoon. So just to go through a few of the things we'll be talking about, the COVID-19 pandemic, how this has been affecting all of us or someone for the past few months, trauma or trauma experience in the wake of COVID-19, vicarious trauma, what that looks like for us as clinicians, as professionals, as caregivers in the field, as advocates, compassion fatigue, right? And how this ties in with trauma response, trauma exposure, changing the narrative. And this is where the real work comes in with beginning our journey to healing, beginning our journey to hope, understanding that we're living in unprecedented time, but this is not the end all be all to what we're going through. So how do we change the narrative of hopelessness to hopefulness? How are you coping, right? We'll spend the afternoon looking at what are the coping mechanisms that you've been using to survive through these times, push through the uncertain times. Are they good? Are they not so good? Are there things that we need to unlearn to move forward? Healing and how healing will look and shape and form as we move forward, right? And this global pandemic and the uncertainty of what we're facing in the United States now, individually and collectively. And some evidence-based practice that we can put in practice this afternoon, right? Some things that we have been shown to scientifically work to help our mind, body, and soul to heal. So before I get started, I want to do a wellness check-in on your emotions. And I want to ask you, I invite you in the chat this afternoon to share with me, how are you really doing? How are you really doing? In this moment, in this time, not 5 minutes ago or 5 hours ago, but in this moment right now, how are you really doing? Right? I feel like this question has been so overused over the past few weeks that it's lost some of its intentionality. It's lost some of its meaning. It's lost. I see that. Weary, exhausted. Yes, overwhelmed, stressed, exhausted. I hear that. I hear that. I feel you. I feel the feelings, right? Sometimes we don't even know the words to use to explain how we're feeling. This has taken on such an genuine and auto response over the past few weeks because of everything that we've been going through. Tired, frustrated, anxious, drained. I see that. Overload, impatient, stressed. Your feelings, you are not alone in what you're feeling. You're not alone in what you're feeling. We have millions of people who have been affected one way or another. If you weren't, you knew someone who was affected and continue to be affected by what we're going through now. So I hear all of this. Heartbroken, absolutely. I thank you for sharing these feelings. Thank you. And as we continue, with the presentation, and as we continue even after, I encourage you to reflect and tap into these feelings and emotions. And when someone asks, how are you really doing? How are you doing really? Right? That you can give these honest answers that you've shared with me. I feel great. I use self-care often. Awesome, Jill. Awesome. That is awesome. We'll speak about that too. Self-care. How self-care play a part in your healing journey, right? So the COVID-19 pandemic, as we know it, is undoubtedly a stressful time for everyone, right? We're going through a collective traumatic experience. We're all suffering. Even if we have not felt an individual impact or a negative impact on what we're going through, you probably know someone who did. If you're advocates working in the field, if you're activists, right, who are out there, you know someone who's been negatively impacted or traumatized by this pandemic and what we're going through. We find ourselves evaluating what's working, what's not working in our lives, whether personally, professionally. We're constantly seeing people around us who are hurting and suffering, right? These are real feelings. These are real emotions. And we're going through this together, individually and collectively. There's a need to help ourselves and to help others and to find purpose in this process, right? We see people who are volunteering. They're trying to make meaning out of madness, okay? We're trying to make meaning out of uncertainty. The what next, we can't we can't fill the blank to what's next, but we're trying to create a purpose. We're trying to help ourselves as we move along. And this process can be overwhelming, it can be mentally draining, and it can be traumatic, right? It can be traumatic. We're there as advocates, as caregivers, as family members. We're there, we're willing to help, but this can take a toll on us mentally, and it can also take a toll on us in a traumatic way. So this leads me into our working definition of trauma that we're going to be working with this evening. Right? So just to put this into context into what people are feeling and the magnitude and scope of what's happening emotionally, mentally, right? Physically. So trauma is a psychological, emotional response or an experience that is deeply distressing or disturbing. Trauma is an emotional response to something terrible that's happened, for example, car accidents, natural disasters, violence, wars, pandemics. Extreme stress overwhelms the person's capacity to cope, right? We're going to talk about coping later on and how stress manifests itself into good coping skills and unhealthy coping skills. Our threshold for trauma is low. We're not built for this, right? Emotionally, spiritually, emotionally, mentally, we were not built for this. Our bodies enter fight, flight, or freeze mode, right? We get stuck. Or we run away. We're going to talk about dissociation in a few minutes and our freeze mode and our running away mode, the denial of what's really happening, not accepting the scope of what's happening in our lives and our environments and in our families, right? Trauma. So I promise you this is not a statistics course. I included some data here so that we can get an idea of where we are as a country, dealing with trauma and who have been affected by trauma, mental health needs of trauma survivors, right? So 70% of adults in the U.S. have experienced some sort of traumatic event at least once in their lives. That's over 200 million people alone in the United States, right? That's a lot of people to have experienced those examples that I gave earlier in the definition, right? Experience of war, experience of car accidents, experience of, sexual violence that has happened to them. That's a lot of people. In public behavioral health, over 90% of clients have experienced trauma. And as advocates working in the field, you see this every day. This is your life. This is your professional encounter with your clients, with your survivors that you work with, right? People are being impacted. Trauma is a risk factor in all behavioral health and substance abuse disorders. So when we talk about co-occurring disorders, right? When we talk about diagnosis of anxiety and substance abuse, right? Underlying factors, trauma might be a factor. When you dig deeper into what happened in the past, there's likely something that triggered this behavioral health issue or the substance abuse issue. Johns Hopkins University, who's now trailblazing a lot of the COVID-19 pandemic research here in the US, they're doing research studying the mental health impacts amid the COVID-19 pandemic, and already we're in June, we're just about 5 or 6 months into this pandemic, and early results from the general public already shows an increase in mental distress due to the traumatic events related to COVID-19. Early results. Usually these researches take years and years, right, to get full data of tracking people and seeing who's being affected, what areas, what neighborhoods, right, what race, who are the people out there that are being impacted by COVID-19. But already 5 or 6 months down the line, and we're seeing early results that there's an increase in mental distress due to traumatic events. And I'm sure in your area of work, you're seeing this as well being on the rise. In New York City alone, or emotional helpline, mental health helpline went from a few hundred calls a day to anywhere up to 6,000. The US released some data that mental health calls, help for mental health calls went up 891% in the last 5 or 6 months. That's a lot of people who are being impacted. That's a lot of people who are seeking help. There's been a nationwide increase in calls to domestic violence helplines and suicide hotlines. That's true. So what does this experience look like? Why are these calls being made? Why are these numbers so high in 5 or 6 months? What's happening? What are you feeling? What are you feeling and what's going on in your life, right? An overwhelming amount of the public experience a traumatic event. As I said earlier, if that wasn't for you personally, if you can't relate to that personally, you probably know someone who does, right? Or who's been impacted, whether personally or professionally. And so loss and grief, right? People are losing loved ones. Globally, millions of people have died. Millions of precious souls have been lost. Jobs have been lost, right? In the United States, our unemployment records went to 40 million people. That's a lot of people who are home insecure, food insecure, right? A lot of uncertainty is going on in the world. Healthcare is a threat in the midst of this pandemic. Businesses, sense of self, personal safety has been a big issue, right? There's increased anxiety and paranoia about people leaving home. There's the message of sheltering in place and social distancing, right, is causing increased anxiety. So personal safety is being threatened. And in the midst of the pandemic, we have racial and social unrest, right? So that adds another layer and another dynamic to the trauma that's been going on here. Isolation. The message through the pandemic has been to social distance. For many people, especially your vulnerable populations, this can be easily translated or result in isolation. So think about our vulnerable population, right? Who are you thinking of when you think about our vulnerable population? Or children in care, right? Or survivors who might not be in the safest shelter-in-place environment with their partners, right? increased paranoia around contracting COVID-19 and how to keep your loved ones safe. So we talk about essential workers who are still out there on the front lines and they're coming home. I'm sure you've seen on the TV and in social media many times that they're healthcare professionals and essential workers who have to leave their own families, right? Make the sacrifice and the choice to leave their own families so that they don't put their health at risk. Or healthcare workers and essential workers having a hard time keeping it together themselves emotionally, as I said earlier. This is draining. This is hard stuff to digest, right? They're on the front lines holding the hands of people who their family members can't be there for them. Absolutely. I'm watching in the chat. CPS calls have increased. I'm a former child care worker, child welfare worker myself. Absolutely, there are increased calls for children who are in danger, vulnerable populations, right? These are traumatic things to deal with. These are heavy stuff for us as professionals to digest, just as human beings to digest, right? Knowing that not every environment is a safe shelter-in-place environment. Healthcare workers, as I mentioned, right? Anxiety and fear for personal professional safety is on the rise. And this is leading to a lot of feelings and a lot of stress and a lot of trauma also for healthcare workers and or frontline workers, right? Vicarious trauma is another aspect of trauma that has been on the forefront for the past few months, right? And this is vicarious trauma. It's real. It happens, right? I know this comes with some form of guilt. Sometimes from professionals, you feel like you're not supposed to feel this way, but this comes from a place of care, right? Or working definition this evening of vicarious trauma is the emotional residue of exposure that counselors have from working with people as they're hearing their trauma stories and becoming witness to their pain, fear and terror that trauma survivors experience, right? So imagine those working in the front line of hospitals, hearing those stories from family members, hearing those stories from their patients themselves, right? That takes a toll emotionally, that emotional residue of exposure. I'm sure many of you can please share in the chat with me if this is something that resonates with you, if this is a feeling that you've experienced, vicarious secondary trauma, right? Consider the emotional vulnerability of our frontline and healthcare workers, the vicarious trauma that they're experiencing while taking care of others. It's important to be aware of the signs and symptoms of vicarious trauma and the potential emotional effects of working with trauma survivors, right? So inadvertently, we're being traumatized as well, right? This might not have as I said, it's not a direct trauma experience that we're having, but just from hearing other stories, what they're been through, what they're going through, right? That feeling of helplessness sometimes that you have when you're hearing a trauma story or listening to someone's story and you're not able to help in that moment. Absolutely. I'm watching the chat. Veronica, this is why we need self-care. Vicarious trauma is real. It is absolutely real. It's also true for family members who are caring for others following a traumatic experience. So this is not just limited to professionals in the field or frontline or healthcare workers. Family members who are also caring for loved ones, right? Who may have fallen or experienced one of the effects or impacted by COVID-19 may also be impacted by this. Some of the signs. So what are some of the signs? Share with me, please. Tell me, how is it you feel? If this is something that resonated with you, if vicarious trauma is something that you could have identified with, what did this look like for you, right? How did this come up and what were some of the feelings associated with it? Here I listed some of the classic signs and symptoms of vicarious trauma: losing sleep over a patient or client, right? We're going to talk about losing sleep in a few minutes. That's been a big thing that we're dealing with as a society, as people. Lifestyle has changed. Inability to sleep has been an incredible factor in some of the symptoms that people are facing. Having difficulty talking about feelings, right? Worried about not doing enough for clients. So as I said, it comes from a place of caring, right? If we didn't care, we probably would not be there listening to the stories of our clients and our family members and other people that we're around or that we work with, our colleagues. Let's not forget our colleagues, right? Worried about not doing enough for clients, dreaming about clients' trauma experiences. These are real things that are happening. These are real trauma experiences. Feelings of hopelessness associated with work. This is important. This is so important. I can use the example of our essential workers, all throughout this presentation because they've just been on the front line. I know a few of you are here in this group as well, because sometimes you walk in or you're doing your remote or your virtual sessions and that feeling of hopelessness takes over, right? The uncertainty of it all makes it, you almost feel a sense of dread, right? And don't feel guilty, right? Diminished sense of personal and professional satisfaction, nothing to feel guilty about. If you recognize that as a feeling, that's a good start. That's a good start to do some self-reflection, some self-awareness, right? And think about the pause, reset, and let's go at it again, right? Let's take another day as a professional with your colleagues, as a family member, right? When you're feeling that diminished sense of personal and professional satisfaction, emotional boundaries, right? When it comes to dealing with our colleagues when we are just not feeling 100%, right? It's okay to establish emotional boundaries in the professional workplace when vicarious trauma is happening to you. Compassion fatigue, right? Compassion fatigue, and what is this? I like to think of vicarious trauma and compassion fatigue almost like cousins, right? They're related in a sense. Compassion fatigue is almost that what happens or the feeling that comes on after being exposed to people's trauma stories, right? The vicarious trauma that you feel, the vicarious trauma that you experience comes with that compassion fatigue, right? In the workplace, in your professional feelings, you're feeling exhausted. It's almost your inability to empathize, right? With people, take breaks, absolutely, right? So let's give a definition of compassion fatigue and what this is. And I'm sure many of you, especially in a time like this, right, when we're going through so much, everything is uncertain, everything is unclear, you're hearing, it seems like there's more bad than good that you're hearing when you turn on your social media feeds and when you turn on, the TV, right? It seems like you're flooded with negative news and this takes a toll on you. So after serving traumatized and serving individuals over time, you begin to experience physical and emotional exhaustion, leading to a diminished ability to empathize or feel compassion for others, right? Losing your compassion, losing your ability to empathize with that person who's laying on the bed who may not have seen their relatives for a few months, right? And then the feeling of guilt that comes with that feeling of not being able to empathize. You begin to question yourself as a professional. How could I not be able to relate to these people? How could I not be able to, how can I not, have some compassion for this person here? Again, do not feel guilty about this. You are not alone in how this feels. It doesn't make you less of a professional. It doesn't make you less of a person. It makes you more aware. So when you're seeing the symptoms, feeling burdened by the suffering of others, the physical and emotional exhaustion, the nightmares, the grief, the anxiety, if you notice some of these symptoms overlap with vicarious trauma, right? So continuously hearing other people's stories will lead you to a place of being emotionally drained. Depression, sleep disturbance again. Sleep disturbance pops up in a lot of the negative things that happened in life, right? Physical complaints, bottling up your emotions, right? Compassion fatigue. Ask yourself, who can you speak to about this? What does supervision look like for you, right, in your organization? What's your relationship with your colleagues, right, that you can speak to? Even seeking professional help yourself with dealing with some of these feelings if you feel like they've been out of control. You are not alone in what you feel. Absolutely not. So that was heavy. That was heavy trauma, vicarious trauma, the reality of what we're feeling, the reality of what we're going through, knowing that people are impacted one way or another. And this evening, our message is a message of hope and resiliency, and knowing and learning when to change that narrative, right? So our presenters last week, Gia and Carolina, did a fabulous job of speaking about our narratives and our stories, and what are the stories that we're telling ourselves, right? When we begin to hear all these negative things that's on social media and the negative things that's being portrayed on the news, how does that influence our stories and our narratives, right, that we're telling ourselves? And how do we begin to now shift from a place of hopelessness to a place of hopefulness and resiliency? And what does this even look like, right? What does this even look like when you're sitting with feelings of grief? When you've lost your job, when you've lost your health care in the middle of a pandemic? You know, what does this look like? How do you begin to even feel hope? Right? Some of this seems impossible. I'm here to encourage you that it's not impossible. It takes work. It takes looking into how are we already coping, right? Vivid dreams. I see the chat going. Yes, absolutely. Absolutely. These dreams, right? The nightmares, all of these it manifests from what we're going through. I'm watching everything in the chat. Keep the thoughts and the comments coming. So to begin changing the narrative, we have to look at what's working, right? What are we doing? How are these feelings manifesting in our lives, right? How are these feelings turning into behaviors that's either healthy for us or unhealthy for us, right? What are the things that we can identify in our lives that we can begin to target, that we can begin to do some self-reflection to say, okay, maybe it's time to try something different, right? Overeating or emotional eating, some of the unhealthy things or unhealthy coping skills that are being manifested because of the impact, because of the stress that we are going through, right? Compulsive spending, right? Amazon made a big amount of money because of compulsive spending during this pandemic, right? Maybe it's time to sit back and reflect on where is my money going and why? Dissociation or detachment, letting go of reality. This is a big thing for a lot of trauma survivors, right? Completely dissociating themselves from what happened, refusing to accept reality, right? Letting go of reality. This is not happening. My life is not being impacted in this way, right? This is just not happening to me right now, right? Dissociating themselves, removing themselves from reality. It's a coping mechanism, right? Isolation, sheltering in place, does not necessarily mean that everyone is surviving well in their own company. People are lonely. This is resulting in loneliness, right? We're human beings that need connection. We need connection for healing. We need connection for growth, for communication. So isolation in the midst of this pandemic has grown to be a very unhealthy, way of coping. Overworking is another. Irregular sleep patterns and self-harming behaviors, right? So, and the list goes on and on, right? If these are some things that you're seeing with your clients and with the people that you work with, right, it's time to start a conversation around what needs to change on this journey to healing and tapping into people's strengths, right? Tapping into what they do well. Even in the midst of some unhealthy coping skills manifesting from all the stress, right? Tapping into what works well for them, and so that the list of coping skills can turn into the healthy ones that's on the left of the slide, right? The journaling, the exercising, meditating, art, music, prayer, yes, love, praise, and worship. Please share in the chat what has worked for you during this pandemic. Music, talking. People are getting very creative with how they are coping and surviving, right? People are thriving throughout this pandemic, right? Going through pictures, absolutely. That's so important, right? Remembering the good memories, remembering the good times, right? Prayer. People are leaning closer and closer to their faith for their healing journeys, right? People are still connecting with their places of worship virtually, and this is an important part of their livelihood, right? So as we continue to navigate this and to look at what's working and what's not, we can be very creative with how we can develop healthy coping skills. This starts with embracing healing from a place of hope, right? Earlier I said my message for you this evening is not one of, well, what's next? Yes, we're asking what's next, right? But hopefulness, right? Hopeful that this what next will turn into something positive. Tuning into our emotions and experiences and acknowledging that what we're feeling is okay, all right? How many times do you do that? Share with me. Share with me in the chat. How many times do you really tune into your emotions? Remember I asked you at the beginning of the presentation, how are you really doing? How are you really doing today, right? That's tuning into your emotions. That's your own wellness check-in, right? And if it's a day where it's not okay, then it's okay to not be okay. And I think that's one of the things that we grapple with many times, even when we're working as advocates and we're working with survivors. We feel like we always need to be our best self, right? But it's okay to not be okay. Recognize that you do not have to have it figured out to move forward, right? One step at a time, baby steps. Feel, and return to your focus. Feel the emotion. You're recognizing the emotions. You're tuning into them. You're feeling them, right? You shared with me frustration, overwhelm, stress, right? Sadness, grief. Feel those emotions. Feel. Return to your focus, right? So if your focus is work, if it's family, if it's your friends, if it's turning into a project that, you had to put away because you just weren't feeling up to it. Feel, heal, and return to your focus. It's during the most challenging times that your grit comes through the most, right? Those soft skills that we need to cope, grit, resiliency, determination, right? If things were always good and pleasant, we wouldn't learn how to use those skills, right? So it's usually during the times that we need it the most challenging times that our grit comes through the most. Allowing yourself flexibility, be willing to bend, but do not break, right? Allowing yourself flexibility. This pandemic it's taking out the most creative things in some of us, right? We're being creative in how we cope, in how we worship, in how our day goes, right? In how we work, in how we interact with each other. I don't know about you, but I feel like I have Zoom fatigue, right? With Zoom meetings and virtual meetings. It's unbelievable. We are being flexible. We are being creative. We're being creative and flexible with the conversations that we're having, with the energy that we're allowing in our lives. So being flexible throughout this pandemic, but not allowing it to break your spirit, right? Your traumatic experience and grief is unique to you. Your traumatic experience and grief is unique to you, right? We're going through a global pandemic together, all of us. But someone's job loss experience from losing a job might be different from another person's experience from losing a job, right? So it's important that we don't compare ourselves to how other people are dealing with what we're going through. Your traumatic experience and grief is unique to you, right? And you grieve however that comes naturally to you, right? So healing and what this looks like. So in my practice and in my work with myself and my clients, these are some of the things that have come up, right, lately in terms of healing and doing the work around anxiety and stress and recognizing and understanding our trauma responses, right? So I've come up with, some words that resonate with myself, my clients, family members that we see coming up more frequently as we try to navigate what our healing and journey looks like and what it feels like to be hopeful. So hope, I have the H there representing hope. Hope in the present and the future. Continue to look forward to the positive outcome, no matter what is going on in your life. Energy, what we focus on, we fuel, right? Invite positive, hopeful, favorable energy into your emotional and physical state. What you focus on is what you fuel. Acceptance, accept the reality of our situation without trying to resist it, right? This helps us not to get carried away with what we imagine or how we want things to be. Accepting things for what they are will help us moving forward. Love, or L in healing is for love. True healing requires love. We're human beings, we need love, we need connection. Love is an action. It's what you do for other people that counts. It's what you do for yourself that counts, right? How are we showing love to ourselves in this time of crisis? Love for self, love for others, love for the things around you. Intentional, right? Intentional, becoming intentional intentional with your purpose. Saying no to things that aren't important, right? Saying no to, giving your focus to things that matters the most. Being intentional with our responses. You know, when someone asks, well, how are you doing today? If you're not okay, you're not okay. And that's an honest, intentional answer, right? And if you're doing great, you're doing great. Becoming intentional with our purpose and our words. Accept the reality of our situation. Yes. Or new normal. This was a hard one for me, right? This was a hard one for me. Or new normal is so confusing. It's so confusing, and it feels, your immediate urge is to resist, right? What this new normal means. You're dining out and you're sitting 6 feet away from someone else, right? Or new normal. Or new normal is now working from home. So we're missing that personal, physical connection with our clients, right? And the people that we help, because everything is now done virtually, right? The new normal. Virtual drive-through graduation, the new normal, right? Means moving forward in this, what this means in this pandemic will be unique to you, right? Unique to you. Many lives and circumstances have been changed. Be willing to embrace what comes next. G, gentle, and growth. It was hard to choose between these two. I had to throw both of them in there because we need to be gentle with ourselves in our growth process. Healing is not overnight, right? Coronavirus, COVID-19 have popped up on us on what seems like overnight and have left us grappling with a lot that needs to be peeled apart and fixed back together. But our healing journey, I want you to be gentle with your growth, right? What works today might not work tomorrow. Don't be afraid to start over again. Don't be afraid to, pause, reset, and get back. Self-compassion, absolutely. Be willing to embrace what's next. Self-compassion. Yes, Carolina spoke so well about self-compassion last week, and we ought to show ourselves that self-compassion that we show everyone else in our healing journey. So how do we do this? I might be running out of time. I think I have around 10 minutes. I'll just briefly go through some techniques that I've used through our healing journey, right? Some things that have worked. You've probably heard of mindfulness, right? This is a very common, a very growing concept in the field of psychotherapy. If this is something that you're familiar with, please, share with us. How has mindfulness helped you during your healing process, right? The quality of being present and fully engaged in what you're doing in the moment. It's so easy to think about what happened 5 minutes ago or 5 weeks ago. It's so hard to let go of the past, and it's so easy to worry about the future. So mindfulness helps us and brings us, right, to a place and a space of calmness, presence, and peace. Growing concepts in the field of psychotherapy and the treatment of depression, anxiety, substance abuse, eating disorders, right? All these things are manifesting as a result of COVID-19. Helps people to accept their experiences rather than react to them with avoidance, right? React to them with avoidance. We accept their experience, the experiences of what's happening. We're not worried. We're not worrying about what happened 3 weeks ago, right? We're putting ourselves in a state of calm, present, mindful being, creative thinking, problem solving. So I don't have much time left. I think I'm running out of time, but I want to leave you with a technique that I would like us to practice together a little bit. And this has helped me. I felt drawn to this mindfulness and body technique in a trauma training, and at first it felt so uncomfortable for me. But if you're like me and your stress manifests itself in your body, right? My stress manifests itself in my jaws. So I find myself tensing my jaws like this, almost like I'm biting down on my teeth. This technique will help, right? With bringing you back to that state of calmness and presence, right? So if you have a comfortable space, I know you might be joining this webinar from many places, right? The beach, outdoors, wherever you are. But I invite you to just, if you can, place your feet, right, flat on any surface, on the ground. Progressive muscle relaxation, right, is what this is called. You can also practice this on your own time. This is a technique that helps you to control your body sensations by paying attention to where in your body you hold your stress. Relaxing the body relaxes the mind, right? When we talk about getting on to our healing journey and bringing all this work, the resiliency, the acceptance, the love, right? The hope into our work, putting all of that into your body, focusing and seeing where you're holding that tension, right? Where are you holding that tension? Stress, trauma, and stress from trauma tends to manifest itself physiologically, right, in our body. So we might be feeling tension in our, in our arms, in our shoulders. That's a common area for your shoulders, right? So beginning with your lower limbs, if you have a comfortable space, you tense your muscles, right? Then relax. You tend to start from your toes with this technique. You start from your toes and you tense your toes, tighten your toes. The purpose of this is to pay attention to where you're in your body, you hold your stress, right? And you tense your toes and you tense your feet, your thighs, you tense your buttock, you tense your abdomen, right? All the way up. You work your way from your toes all the way up. You tense your shoulders and release. Tense and release. Tense and release. And you do this as often as you need to. Tense your jaws. This works well for me because this is where, as I said before, this is where I carry my stress. Many times I don't realize it, right, until it's pointed out to me that I feel that tension is obvious, right? So tense and release. Tense and release, right? Practice this at any time, anywhere you feel your body, right, responding and relaxing at any place when you feel like you'll have tension, right, in your body. Grounding, I won't go through this. I think this presentation will be shared with you, the slides, but this is also something you can try on your own time. Effective coping technique for anxiety. Take a deep belly breath. Our breath and our senses are two of the most accessible things that we have, right, in our treatment of anxiety and focus, mindfulness and grounding, right? Take a deep belly breath. Name 5 things you can see, 4 things you can feel, 3 things you can hear, 2 things you can smell, and 1 thing you can taste, right? This is using your senses to bring you back to the here and now, the present moment, right? To the present moment, focusing on your senses and your breathing. Okay. So before I leave today, I appreciate your questions. I'll get to your questions. I believe we have a Q&A time after, and I'll get to your questions then. I've gone over my time, I believe. I'm so sorry, Vanessa. But I want to leave you with this quote that resonates with me, even prior to COVID-19, as an immigrant woman of color living in the United States and having to, navigate a lot of uncertainties, right, of my own, and uncertainties along with my family, my clients, right, as a professional, personally. This quote resonates a lot, and I hope it does for all of you too, that every scar that you have is a reminder, not just that you got hurt, but that you survived, and that's from our former First Lady, Mrs. Obama. Every scar that you have is a reminder, not just that you got hurt, but that you survived.
Thank you so much, Latoya. And I wanted to tell everybody that Latoya is going to be joining us next week. So make sure that you're registered for next week's session. And now we are ready for you, Vanessa. Take it away.
Thank you so much, Latoya. That was wonderful. Thank you. Thank you. So I am going to go ahead and get into my part of the presentation here. And one of the things that I always share in all of my presentations, and by the way, I'm coming to you from Frederick, Maryland, which is an hour outside of DC. And so I'm really excited to be with you all, and I loved seeing that you all were from all over. I mean, I saw, from Hawaii to Nova Scotia to all the different 50 states. So I think that's so wonderful that during this time where we are so separated, we have to be separated because of physical distancing and social distancing, that we can come together in this way. And I think that there's a lot of power in that. And so I really want to focus my portion of this presentation on healing the collective. And so just simply by gathering here together, we're able to heal the collective. And so everything that I'm doing today is with this sentiment. So I do a lot of child-based work, and so I love Dr. Seuss for this reason. And I always share this in every single presentation that I lead. So Dr. Seuss said, unless someone like you cares a whole awful lot, nothing is going to get better. It's not. I love this. It is one of my guiding values, and that whatever I do in my profession and my job as a mother, as a friend, it will be done so with a lot of care. And so I come with you today with knowing that I've put a lot of care into today and in connecting with you all. The other quote that I always share in all my presentations is this quote by Judith Herman, who's a wonderful writer on trauma. And so this book that I'm quoting underneath here, Trauma and Recovery, is something that is recommended reading for any advocate out there. But she says, atrocities refuse to be buried. Remembering and telling the truth about terrible events are prerequisites both for restoration of the social order and for the healing of individual victims. And so, Latoya was saying when she was talking and defining what trauma and vicarious trauma and compassion fatigue are, that this is really heavy. Defining these things and making sense out of these things are heavy things. And likewise, as we talk about this pandemic and what it's doing to our functioning, that is also heavy. And the reality of knowing that some of our loved ones may be getting very sick, or we ourselves may be getting very sick from this, is also a harsh reality. And so I want to honor how hard that is, and also know that we can't get to the other side without going through what I call an in and through process. So we're going in and through in order to get to the other side that honors healing. So for today, I'm going to make sure that we learn about this from the lens of a holistic approach that will honor our cultures wherever we're from, and bringing that sense of meaning and spirituality to ourselves. So I want to further define collective trauma. So collective trauma is, we all heard Latoya give the definition for trauma. Collective trauma is now speaking to what we are all experiencing at the same time. And this is what's extremely unique about what is happening right now, is that every single person, every single country in the world is being touched by COVID-19. Our lives are being uprooted in very big ways because of COVID-19. And whenever there is something that is shocking like that disrupts our sense of safety, and it happens in large groups of people, then we experience what I call collective trauma. And I'd like to define that term, because if there is collective trauma that is happening, we can also access collective healing and resilience. And so I want to make sure that we leave today with very substantial, easy practices that are going to continue to support collective resilience. So if you could please write in the chat, I'm really curious to hear in your own communities, we have people from all over. And so I would really love to hear what are the collective sentiments that you guys are hearing in your circles? This is from in your professional circles, with your family or your friends. What are some of these collective trauma sentiments that you're hearing? Fear. Uncertainty. Yeah, Melissa says fear of returning to work, anxiety, hopelessness, bills not getting paid, despair, isolation. Yeah. I will say this. Oh, this is wonderful. Okay, I love this. Okay, so some people are saying racism, losing everything, inability to help, unknown changes, masks have begun to become an issue, either for or against, loss of trust, missing loved ones, confusion, unpredictable, helpless against an enemy with no face. Yeah. Everything that everybody's writing is the pure definition of what trauma does to us and what those feelings, what those underlying feelings are. And, you know, I really can resonate. Somebody wrote on their anxiety about returning to work. My husband is a scientist, and last week he returned in-person work, and with, of course, a lot of, you know, safeguard measures. And that night, I had a nightmare. And my nightmare was all about protocols and safety. And so, you know, that's one very easy, concrete example of what some of these collective sentiments that I obviously was carrying that I really wasn't conscious of can manifest into our spirits, into our bodies, into our psyches. So, and then Carla writes, not being able to see your parents in a nursing home, not being able to hug them. Yeah, for those of us that have parents in nursing homes, or even if we have family members in other countries, you know, that feeling of I can't even go and help and visit. So this is really tough stuff. And I wanted you all to write to put this stuff down because I want to make sure that I am addressing your collective sentiments, what you guys are hearing in your communities, so that when you leave here today, you know what to do with some of these collective sentiments. Okay, so there's a couple of things that I want to utilize to frame our discussion, and with regarding to all of this healing work. That you all as advocates and humans need to really have a solid understanding of. So I'm a big fan of research and what the science says on all of this, on risk and resilience. And Bruce Perry is someone who is a child psychiatrist and brain researcher. And these graphics are from his work. And so what I want to echo in this chart right here that you see displayed is that in order to understand resilience, we need to understand risk factors. And what this is saying is that these vulnerabilities that we are listing as adversities, the more adversities you have in your personal life or that you see your the clients that you serve have, the less likelihood there is for resilience. Okay, some of those adversities listed here that the research has identified are poverty, homelessness, unemployment, racism, which is something that's getting a lot of conversation right now, which is really great. Cultural marginalization, community fragmentation, community violence, domestic violence, maltreatment, and children, whether having your own children in care and foster care, or the state care, or children being in care. So these are all adverse events that have been documented in research to lead to lower resilience, okay? So with that comes a specific type of coping. And what the research has identified is that when your vulnerability is high, when your adverse events are high, you are more likely to engage in minimal daily structure, comfort eating, consuming too much media, whether that be TV or social media, feeling emotionally isolated, self-focus, so struggling with being able to, this self-focus is referring to the ability to be self-absorbed. Like, it's only about you. This is only about your experience. It's all about how you're feeling. Sleep disruptions and negative ruminative thoughts. So ruminating over your thoughts and feeling generally stuck because you're going through a negative thought cycle, or you're revisiting past things that have happened, past trauma that has happened, resurfaces, and you stay stuck in a loop. So the more adverse events you have, the likely that your coping will be in this form. And I want to acknowledge that this is not about bad versus good. This is the reality for a lot of people. People are doing the best they can with what they know. And so for you all as advocates and professionals, it's important to digest this information, because then you can now see how you can intervene in your own lives as being models in your community, but also with the people that you serve. And so I love this graphic. So this is where we get into shifting, right? So if we know that there is high adversity and that there's this type of coping, then we know we need to move the curve over on this side, okay? We need to move our resilience over. We need to have a shift in our pattern. We do this by doing all of these practices which have a regulating effect on the brain and nervous system. And this looks like having a daily structure. And what that means is having a specific flow to your day that feels predictable. That's one of the things that in this pandemic has gone out the window. Think about the children that were in school having a specific routine, and then all of a sudden they're home. And if you don't have care for them, you're caring for them, so your routine has been also, gone all over the place. Your sleep may also not be consistent and different. Your diet might be different. So what this is saying is that you need a specific daily structure and flow to your day. The children also need this. Family meals together, limiting your exposure to TV and social media. And this is something that I like to describe on a continuum. Start to notice the patterns of, when I watch X amount of TV, this is how I feel. Or when I expose myself to this much social media, this is how I feel. There's a threshold. One of the things that I am telling a lot of the parents that I work with who feel really guilty that their kids are spending so much time on the iPad is to practice a sense of, are they doing something that's somewhat productive on the iPad? Are they able to entertain themselves in a way so that you also get a little bit of a break? So not all iPad time or phone use is bad. It's on a continuum, and right now we have to get what we can get, because these devices are replacing our ability to connect with other people because we can't. So if we can use these devices to actually further our connection, then that's a good thing. So I just want to make that really clear. Exercising, as Latoya was saying, stress and trauma gets trapped physiologically into our bodies, and so exercise is a way to expel that outside of our body. And that can look like something like walking. It doesn't have to be this big exercise regimen. It can be walking, doing planks. Sometimes if I'm feeling really lazy, it's just easy to do a plank. And you're using your strength, which is priming your brain and your nervous system that you are in control. Reaching out to others, having good sleep hygiene, and staying positive and future focused. I kind of am allergic to the word positive because I feel like sometimes this word positive takes us away from reality. And so I want to maybe rephrase that positive to staying hopeful and focus that whatever is happening right now is not permanent, and that there's other things that are going to be happening that you can look forward to. Okay, so all of these things that I just spoke to in this graph have to do with interpersonal neurobiology. And that's a really big scientific word, but really what that means is that healing is a relational act, that we can encounter healing just by being with another person and hearing them out. And so any of those things that you all can do when you're reaching out to a friend, your friends can also hold you accountable. Your coworkers can hold you accountable to do some of these things that are on here. All right, so now we're going to get to some nice experiential practices. And one of those things that we're going to practice right now is coping with COVID grief and stress. So when I was hearing the collective sentiments that everybody was typing in the chat box, I saw a lot of what can be termed grief over old life, old way of doing things, and what used to be your normal. And so I want you all to be able to feel what the difference that this can make for you. And so what we're going to do, this is a technique called the emotional freedom technique. EFT is what we call it for short. And this has been documented by researchers to be very effective in shifting. So Jacqueline Miller asked a question earlier. She asked, what can be done when anxiety or an increased heart rate starts when hearing messages of liberation and self-care, such as this? So Jacqueline is onto something. As helping professionals, we are really good at trying to help other people. And sometimes it is hardest to help ourselves. That's just a theme that I see across the board in all of my work. And when we feel that anxiety of over self-care, it really is an indication of compassion fatigue or vicarious trauma, that is literally in our bones. And our body is trying to send us into fight, flight, or freeze mode. So our bodies are kind of instinctually wanting us to not engage in those practices because it feels unfamiliar to us. And so one of the things that is really important, and this is what Latoya was saying also earlier, is that we can't avoid our negative feelings. This is why I'm a little bit allergic to the word positive. We can't, sometimes people say you have to remain positive, and sometimes that takes you away from the reality of the moment. Well, guess what? Right now, I don't feel positive, and I'm not positive, and I'm not hopeful. And so part of healing that sentiment is being with that sentiment. And so what I would say to your question, Jacqueline, is that your body is sending you signals that it doesn't want to do something. But cognitively, as we listen to these presentations in this series, we're understanding that self-care and liberation is really important and that we're all worthy of it. So the underlying message or the underlying feeling underneath that is a sense of fear, a fear of self-care. And so we can use that same fear, and we can do some EFT, we can do some tapping with it. So what I see here, what I can turn this into, I'm thinking through this right now. So this, what we will be repeating to ourselves is, right now I feel blank and I fully and completely accept myself. Okay. So if we play off what Jackie was saying, and this is just an example, Jacqueline, sorry to call you Jackie. Jacqueline, I'm going to give this as an example, but I may choose to do one different collectively in case that's not what everybody's resonating with. But an example of this for you specifically, Jacqueline, is right now I feel scared to take care of myself. Or right now I feel anxious to take care of myself, and I fully and completely accept myself. That would be your statement in this exercise. So you honor the feeling. You honor that your heart rate's going up and you're getting a little bit of anxiety about this self-care talk. And then we'll talk about how we address that physiologically in the body. Jacqueline, I hope that that's helpful to you. And I know that the chat box has been going, and I've been really excited about talking about this. So I'm looking through it right now and see if that resonates with you, Jacqueline. Okay, all right, great. So what we're going to do now is I want you to put in the chat box. Think about this pandemic and the overarching feeling, and go ahead and put that in there. I'm going to see the theme in that, and then we'll go ahead and develop our own collective statement. Yeah. I'm seeing Dawn say, if someone feels stuck, how should they address that? So stuck is a feeling. You would say, right now I feel stuck, and I fully and completely accept myself. Stressed and sadness, frustration, fear and anxiety, unhelpful, out of control, alone, unable to care for those close to me, overwhelmed, lonely, helpless. Okay. So let's go with, I'm seeing all of your responses. These are so good. I love to see the differences because we're all so different, and we definitely cope and feel different things. Oh my gosh. Jeanette says, scared that my being out of work might jeopardize my 80-year-old mom who lives with me. Okay. So I'm trying to, what we will do is the collective statement that we will try to do is, right now I feel overwhelmed and scared. And let's change scared to fearful. Right now I feel overwhelmed and fearful, and I fully and completely accept myself. Okay? That's great, Jan. Jan says, I'm loving this. I feel like we have a new support group. Yes, that's what this webinar is about. Let's access some healing together. So that's going to be our collective statement that we're going to do. I'm going to take you through what that looks like. You don't need to do it. I just want you to watch me. And then I'm going to lead everybody in this exercise, okay? So you see in the slide, the karate chop. This is where it begins. And so we're going to do this. And I hope that the screen keeps up with me, the speed. Okay, that's what the karate chop looks like. I'm going to repeat the statement. Right now, I feel overwhelmed and fearful, and I fully and completely accept myself. After I do this enough times, I'm going to take it to the top of my head, and I'm shifting from left, right, left, right, left, right, okay? There's something special that happens to our body and our brain and our nervous system when we practice left and right brain movement with our hands. So we're practicing bilateral stimulation right now, which stimulates the left brain and the right brain. The right brain stores our emotions and our unconscious. Our left brain stores our to-do, or rational. So it helps to connect both sides. So we do our head, then we're going to move to the, like the graphic shows, our forehead. Then we're going to move right here, under eyes. This is my favorite spot. This is where I hold my stress. So sometimes I just stay here the whole time. Then we're going to do right here the sides of our eyes. Then we're going to go right here, upper lip. Then we're going to do our chin area. Think about how much pressure we hold in our mouth, our jaw. Okay, then we're going to do our collarbone. And then I like to go crisscross, and we're going to be getting our lats. That's what is referred to as underarms, okay? So I just showed everyone the process that we're going to do, okay? Now, and please, if you've been scrolling and doing other stuff while watching this webinar, right now is not the time. Please engage in this. I promise that it will be worth it. So I want you to gauge from a 0 to 10 before we begin the feeling that you have with regards to right now I feel overwhelmed and fearful, and I fully and completely accept myself. So from a 0 to 10, how overwhelmed and fearful do you feel? A 10 being I feel I'm at my worst right now with my fear and overwhelmness. And a 0 meaning it's non-existent. Yay! I'm seeing high numbers. This is good. Let's celebrate. Let's celebrate these bad feelings, these feelings that make it hard to function. Okay, so that's where our number is. Let me give you guys a little fact about how our rational brains work. When we are above a 5, we can no longer take in information in a rational way and process coping in a rational way. So when we gauge a feeling and it is above a 5, our ability to be productive goes down the drain. Our thinking brain is not working. Instead, our nervous system is in flight, or freeze mode. So everybody here, I mean, I've seen only numbers above a 5, which is excellent, okay? We're going to do this exercise together, and then we'll re-gauge where we are. So if everybody can stop whatever they're doing and take advantage of this group therapy practice, please do so. So plant your feet on the ground. If that means I'm little, so I have to get on the edge of my chair to do that. So make sure, even if it means getting on the edge of your chair, we're going to take 2 centering breaths. So breathe in and out. And again. And out. And we're going to do one more from our bellies. In and out. All right. Now we're going to begin with our karate chop. You can repeat after me out loud, or you can just listen to my voice. Just do what I do. Right now, I feel overwhelmed and fearful, and I fully and completely accept myself. Close your eyes, go inward. Still doing the karate chop. Right now, I feel overwhelmed and fearful, and I fully and completely accept myself. Now we're going to switch over to top of our head. Don't forget to breathe. When I do this, I automatically start rocking back and forth. This is even better for your nervous system. Right now, I feel overwhelmed and fearful, and I fully and completely accept myself. Relax your shoulders as you tap on the top of your head. Now we can move to the top of brow, forehead area. Deep breathing. Right now, I feel overwhelmed and fearful, and I fully and completely accept myself. Staying on the forehead, right now I feel overwhelmed and fearful, and I fully and completely accept myself. Now we're going to go to under eye. Right now I feel fearful and overwhelmed, and I fully and completely accept myself. Keep breathing. Now we're going to go to the corners of our eyes. The outer part. Right now I feel fearful and overwhelmed, and I fully and completely accept myself. Upper lip. Right now I feel overwhelmed and fearful, and I fully and completely accept myself. Now our chin area. See if you can have a nice loving gaze as you tap on your chin. Right now I feel overwhelmed and fearful, and I fully and completely accept myself. Keep breathing. Now we're going to go to our collarbone. Right now I feel fearful and overwhelmed, and I fully and completely accept myself. Keep breathing. Now we're going to go crisscross to our underarm area. Last. Keep your gaze in a loving way towards yourself. Right now I feel overwhelmed and fearful, and I fully and completely accept myself. Keep breathing. I was feeling overwhelmed and fearful, and that was okay. I am okay. I fully and completely accept myself. All right. Now we are done, but I want you to take your gaze somewhere in your room. Don't look at the screen. Take your gaze somewhere in your room that feels neutral or positive, and just stare at that spot for a moment without looking away. I'm looking past the window that has these beautiful ferns that I'm going to tell you in a little bit about. All right, do a couple breaths staring at this spot. And slowly come back to the screen. Oh, I love that somebody was looking at owls. All right. Okay, so I'm seeing some responses. And now I want you to check in with yourself. I feel I'm on a high right now. My body feels light. It doesn't feel overwhelmed and heavy. So if you can go ahead and from a 0 to 10, put in your response of how you feel with the feeling fearful and overwhelmed now that you've done this exercise. Nice. Yes. Okay. So 0 means, yes, I'm not feeling that feeling so much. Good. Okay, so I'm seeing a lot of decrease, which is the goal in that exercise. If you're doing it and you're not noticing a decrease, it means you need to keep doing it for longer. You can do this for 30 minutes. you can do this for a long time. We just did that practice. I think it was no more than like 5 or 6 minutes. So it goes to show you how powerful that was. Yes. Okay. So good. I'm seeing that this has gone down for a lot of people, and for those of you that are still a little bit high, I hope that it went down from your original. And again, the way that I know when I need to stop is it was so easy for me to smile towards the end. As I was saying, using the word fear and overwhelmed, I couldn't help but smile. And so I knew that my nervous system was making a positive shift. I intuitively did that, but it's good to sometimes, if you're having a really hard time, I prompted everybody, go do a soft gaze, smile as you say this. That was me also prompting you guys to move along, and you guys can also do that with yourself. I also improvised a little bit towards the end with also accepting that there was a shift when I said I was feeling this way, and that was okay. So this practice that we just did right now, it's really about radical acceptance. This practice is about owning where we are and being okay with where we are. It is not about going to the next thing. It is about being fully present with our feelings. Radical acceptance, yep. All right, so to finish up, okay. Sorry, we've got a little over. I want to just highlight a couple of things, and you guys will get these slides, but the recipe for resilience, as I was trained in it over 10 years ago, is this. We follow what our ancestors did. So from our ancestors' blood and their DNA and their spirits live inside each of us. Maybe we've tapped into that kind of healing, and maybe we haven't. And if we haven't, may this plant a new seed for you. And the way that our ancestors survived and thrived in times that were not modern were through movement and play, art, music, and nature. It's that simple. Forget all of the complicated coping skills that anybody else can teach you. Your recipe in resilience is getting in tune with how did my ancestors survive? And however they survived, that was their gift to me. So if you're having a tough day, ask yourself, what am I going to pick? Movement? Am I going to go doodle, color on the coloring book, go do some art? Am I going to go listen to some music or go dance? Am I going to go on a hike in nature? Am I going to stare at plants? Am I going to take care of my plants? It is that simple. So please, if there's any slide, there's 2 slides that are really important here. This one and the one before, the EFT one, that's your recipe for coping through this pandemic, and you do that every single day, and then you will begin to thrive. This was my last closing visual that I'll take just a minute to talk about, because this is what embodiment of resilience looks like, okay? So on the left, we see somebody of maybe Caribbean or African heritage, and she's dancing. I want you to really look at her face. There is joy in her face. There is strength in her legs as she dances. She is feeling empowered and hopeful. She is center of stage. There's people behind her that are playing music, and she's dancing to the rhythm of the music. That's what music and dance therapy and movement therapy looks like. And so as I look at her, because of the interpersonal neurobiology that we all share, I am now blessed with what she's giving us. And I'm not even dancing right now. If we go down to the corner, we see a child that's walking in nature. He's trying to balance. He's using his legs and he's being focused. He's feeling strong. In that moment, as he's literally walking in that log, there is nothing else that is happening in his brain other than I have to balance. As I say this right now, my legs are feeling activated. I am feeling his groundedness. Now you come and you look at the sky next to that child, and this is my favorite thing to do, is just look up at the sky. This takes 1 second of grounding. You look up at the sky, and what's in the clouds? What do those clouds look like? What does it remind me of? Every time I look at the sky, I remember that I am so small, and that somewhere out there in the world, there's other people looking at the sky too. So it always reminds me of interconnectedness. It also helps regulate my breathing. As I watch the clouds float, I breathe with them, and it helps to regulate my breathing. And then on the right-hand side at the bottom, you see indigenous children from a tribe in New Guinea. And you see the smile on their faces. They are one with nature. They are proud of their heritage. They're happy, they're connected, they're honoring who they are. I smile so big when I see these kids. Their happiness is contagious to me. Them owning who they are is contagious to me. And this is how we practice being connected to one another and allowing the healing of the collective. Now, those other two images are two paintings that I did, and I'm sharing these because it's easier to share my own work than somebody else's, but also because Arlene, when she reached out to me to do this presentation, she said, I hope that you share some of your art. So I'm doing this to also honor Arlene and how kind that was that she wanted me to share some of my art. These are two large paintings that I did, two different large paintings. And the one on the left is called Mother and Child. And these were inspired from the ferns in my yard. And I started to do a study on ferns in March. When I started in the beginning of the pandemic, and they started to poke through the ground. And I was just in so much awe. And that was my pandemic project, was to witness their growing and their unfurling every single day. And as I did this, I felt so inspired, and I realized that ferns are such social creatures. They love to be together. They love to grow together. And so I named the one on the left Mother and Child to honor the beautiful relationship in mothering and growing a little human. And the one on the right is called Partners. Because the other funny thing that I noticed about ferns is that when they begin to unfurl, a lot of them don't face each other. They kind of grow in opposite directions. And when they were in that stage, they looked like they were a little bit mad at each other. And I got a kick out of it because as I was watching this in nature, I was also really mad at my husband. And, that's the pandemic for you, right? We're spending so much time with our loved ones, and it's so easy to get mad at them right now. And so I started to really think about how romantic relationships are and how, you can be mad and that's okay, and you still grow. These ferns still grew, they still unfurled. What was destined to them was, get a little bit of sunshine, get a little bit of rain, be planted on the ground. We're here together, we're going to grow. And so that was my inspiration behind these two pieces. And this is what it looks like to cope. And I'm not sharing this because, oh my gosh, this is so amazing. I'm sharing this because this is one example that we can all, anybody can do this. My youngest daughter right now, when I painted these, actually I should have shared her art. She painted some too, and she video recorded herself. And she's teaching a class to other people. And she's only 5 years old. And in her video, she said, if you want to be an artist, just be one. And she giggled. And that was all the medicine that I needed to hear. And I loved it because at 5 years old, she understood that making art and doing art isn't about skill. It's about just doing it and embodying it. And so I want to close today with, I think maybe we'll do a little bit of Q&A. If you want to get a hold of me, you can get that's my information listed up there. But thank you so much. I have loved being with you all today.
Thank you, Vanessa. This was amazing. And Latoya, if you can join us, we have a couple of questions. You guys, oh my God, I'm so light. Let me tell you, that's how I truly feel. So Vanessa, Gabrielle was asking, Vanessa, do you have any advice for clients who might have a hard time holding their arms up for long or reaching the underarm? Just do one of the sections. It's okay to pause or not. And somebody else also, let me see, go ahead, answer that one.
Yeah. So, Gabrielle, thank you so much for asking that question. The most important thing when you do the EFT is the bilateral stimulation. And so for me, sometimes, because I know that I hold my stress in my eyes, I just go straight to my eyes and I only do it there. So the reason that we did all those thoughts is because we have energy meridians that are connected to specific organs, and that's where we hold some of these emotions. So there is a reason for why we hit all of those energy meridians, those energy centers. That's a very scientific reason. There's actual visuals that say all of the different vessels and energy centers that are located there. But if this is too hard, then that's okay. Do it for a little bit. Find another spot that feels good out of those meridians. I really want to emphasize that this is not a dogmatic, we have to do it a specific way practice. This is an intuitive thing. Do it the way that it's taught and then make it your own and make it intuitive. Don't discount what your body is telling you. If your body can't do this or can't do this.
Great. Is there an amount of time? That's another question that you need to spend on this exercise.
So the best gauge for how long you want to spend on this exercise is when you see a decrease in emotions below a 5. So if you started above a 5, making sure that it goes under a 5, because that's when you're actually going to be able to be rational and taking in information. And again, you can do this before bed, before you start work, before you see your kids, at any time in the day. I do this so much that literally, if I do this just for a second, I'm back to center. So it's a muscle, and we can strengthen it by doing it more consistently, because right now, if this is new for you all, this is a weak muscle. And so what's more important is that you just do it, whenever you feel called to do it, to strengthen it.
Okay. Thank you so much. Latoya, I believe this question is for you, maybe for both. And it's hopefully this is how you pronounce your name, Jaffe. I'm sorry if I mispronounced it. How do we tend to folks who are experiencing trauma when they're out walking, specifically related to mask-wearing practices and danger in public places?
Okay. Vanessa, you want to take that one? I think that wasn't related to your presentation when you gave that example around walking, taking walks.
Okay.
Yeah. So how do we attend to folks who are experiencing trauma when they are out walking, specifically related to mask-wearing practices and danger in public places? This is really tough. if somebody is having, my honest advice is if this is becoming something that's impeding their ability to walk, it might be better that they actually have the guidance of a therapist that helps them through. But again, before the walk, if it's unrealistic anxiety that's overtaking them, then you can do this exercise, and what you would be replacing the blank with is, I feel anxiety over going on a walk. That's what you would be saying to yourself, and I fully and completely accept myself. And, doing it for as long as you can until you're able to downregulate. So you're regulating the anxiety in your nervous system in that. So that's one way that you can give them as a specific tool, and I hope that that's what is addressing the question. But if this is a chronic thing, then I think this is when it would be important to connect them with somebody that can help them with how overwhelming it is to cope right now with this, with the mask, and the danger that does exist being in public.
Awesome, thank you. I want to remind everybody that next week we'll have our third session, part 3 of our series. If you have any questions for Latoya, she is going to be joining us. If you have any questions for Vanessa, we have her contact information. You can follow her Facebook and Instagram. So this has been an amazing, amazing presentation, ladies. We are so, so proud of you, and I'm sure our friends have enjoyed the presentation too. I want to remind everybody that after this webinar, you'll be receiving, an invitation to fill out our survey. Please do so. Let us know, how you felt, if this was a topic that touched you, and how we are impacting your work. So please take a few minutes to fill it out, and also follow us on social media if you want to learn about, or get up-to-date information about NRCDB and the work that we do. There we go. You can see our hashtag and our handle. Please, 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 join us next week. If you have not registered, there's still space. Go ahead and register. It's the third part of our sessions. And I want to give a shout out. Vanessa was talking about Arlene, and Arlene is our Vice President of Programs, Prevention, and Social Change. And she was the one that came up with this idea about this series. So, hey, Arlene, thank you so much. This has been amazing. So thank you, friends, for joining us. I know that this has been a little bit, an extended webinar, but it's amazing. Remember, you are going to be receiving an email possibly next week with a link to the recording, or you can check out Bonnet, our online library, and you can access all the materials there. And just thank you. Thank you, everyone. Thank you, Vanessa and Latoya. I said it again. I feel lighter. Thank you for, joining us, saying yes, and for giving us this gift.
Thank you.
It was my pleasure to be here.
Well, take care, everybody, and we'll see you next week.
Okay. Be safe.